I see at least 10 to 15 patients a year who all they have is a dull aching headache and they end up having a brain tumor. So any difference, any change in personality, don't attribute it to old age or don't attribute it to menopause or don't attribute it to stress. Get it investigated.
What is the connection between perimenopause, menopause, postmenopause and brain?
It's a neuroendocrine event.
Yes.
Estrogen is very important for a lot of brain function. When estrogen depletes, it's also responsible for the synaptic connections between the brains. So when they get affected, your mood gets affected, you start having lapses in memory, concentration, there's a certain degree of mental fatigue, certain degree of physical fatigue, decision making. That's why it's called brain fog, right? Everything becomes a little cloudy. Guy who had a spinal cord injury was airlifted and got to us. We told him that it's almost uncertain that you're going to be able to walk again. And the mother very, very sternly told me, आपने आपका काम किया, अभी हमको हमारा काम करने दो. Then 3 years came into my office walking. Mom said we recited the Hanuman Chalisa every single day for the last 3 years. And we have to accept that there is the power of faith, the power of conviction. There are some things that science will not be able to explain. Would you marry someone who you know is going to die? I had a couple, they'd fixed a date for marriage. A couple of weeks after, the guy got a seizure and they found stage 4 brain cancer. They didn't cancel the wedding.
Oh, wow.
They went ahead with the surgery and then had radiation, had chemotherapy. 9 months later, he had a everyone's supposed to do the right thing. But would you actually do that?
Dr. Mazda Turel is a Mumbai-based neurosurgeon, spine surgeon, writer, and author of a book called Page of Fry. In this episode, we sit with him to understand the brain beyond scans, surgery, and medical terms. We explore how the brain shapes memory, mood, identity, behavior, confidence, and personality, and how illness can change not just the patient, but the entire family around them. Welcome to the Dr. Aditi Govitrikar Show, Dr. Mazda Turel.
Thank you so much. It's such a pleasure to be here.
You were greatly inspired by your father to become a neurosurgeon. Now, of course, there is this saying that my father was an alcoholic, therefore I drink, or my father was an alcoholic, therefore I don't drink. So you obviously fall in the first category. What about the brain or the neurosurgery part attracted you the most as a child?
I think watching videos of the brain being operated on, my dad used to come home and he used to put on videos on via VCR at that time.
Yeah.
And we had a big TV screen. So to be able to watch the brain in all its magnanimity and magnificence, to be able to see arteries magnified, to be able to see actually blood flowing through these tiny vessels, it was very, very enchanting. And then to hear him talk about cases and to tell us a new story every day of a patient and of recovery and otherwise going the other way around. So all of those things, I think, really stuck with me. And then we've still not been able to decipher so much of the brain. It continues to remain a mystery.
Yeah, that's true. I mean, there are still so many new. Suddenly, you read, this center was discovered, and it's now
they're
called...
even naming new anatomical structures till
exactly.
date. So just when you thought this was done for centuries and centuries, we're still able to decipher certain structural elements in the brain that are not been discovered or not been spoken about. So that's really fascinating. So it just lends itself to infinite possibilities, and that's why it keeps you engaged constantly. Just when you think you know a little bit, it surprises you.
So as a child, your father wanted you to be a doctor?
You'll be surprised. No.
Okay.
In fact, he discouraged me from becoming a surgeon. He said that if you're not willing to sacrifice your entertainment, your joy, your partying, your social life, and even till date, you're planning something and you have to go back for an emergency.
Right. So from the time you started to today, you've practiced for how many years now?
I'm in clinical practice now for about 10 years. Individually, separately, on my own. But it takes about 5.5 years of MBBS, 6 years of neurosurgery training, 3 years of working as an assistant professor
Yeah.
at the place where I trained, which was CMC Vellore, and then 3 years of fellowship. And after that, it's been about 10 years.
So from the time you first cut open your patient on your own to today, what is that one biggest change in the surgical field that you have seen, which has been like, oh, wow?
I think the technology of Neuro-Navigation really has enhanced our concept of minimally invasive surgery. Initially, we could open the head by using certain landmarks that we were taught. But now with Neuro-Navigation, which allows you to see the brain in a 3D space, you just put a pointer and it'll tell you exactly where you are. And you're able to use robotics through that Neuro-Navigation to go into very deep-seated structures of the brain. Let's say if you want to take a biopsy from the hypothalamus.
Yeah.
I think that millimeter precision has been probably the biggest change, and allows us to also make our surgery very, very minimally invasive.
This story that you've written, so Dr. Mazda has written a book which is amazing. It is truly enlightening, I would say. In this, you have written about this lady on whom you operated whilst you made a talk.
Yes.
So tell us about that a little bit.
So awake brain tumor surgery has been used for decades. And in fact, I just did one awake surgery this morning before coming, but that was just to drain a hematoma from someone's head. But when you, let's say, have a tumor in an area that is controlling speech or some form of language function, you don't want to disrupt that area. So when you're operating on the brain, you can operate on the patient awake because the brain per se feels no pain.
Yeah.
You can numb the scalp.
Which is surprising,
it's
isn't
amazing.
it? I mean, that part really fascinates me.
Yeah.
The origin of pain is because you feel it through
You
your
can
peripheral
sense it.
nerves or
Yeah.
wherever. But brain itself is painless.
Yeah, you can actually go on the brain surface and knock on it and the patient won't feel anything.
Yeah, which is
But
amazing.
it's the structures around the brain. So the skin is pain sensitive. The periosteum, the covering of the bone is pain sensitive. The dura, which covers the brain, is pain sensitive. The fibers along the blood vessels, they have pain fibers.
Yeah.
So when blood vessels, and that's why you get migraine. When blood vessels constrict and vasodilate, you have pain. But the surface of the brain or the brain parenchyma per se does not have pain sensitive
So the grey
fibers.
matter and the white matter.
The grey matter and the white matter.
Coming back to brain, and you did talk about the genetic predisposition and the gender bias that brain also has to maintain the health of the brain right from childhood. What should people do? The fact remains that people only look at brain when something goes wrong.
Yeah, any part of the body, right? You don't really...
Your brain is just
value
taken for granted. Like skin people still take preventive care.
I think we must look at first principles. Do what has worked for generations. Eat right. Eliminate all kinds of unprocessed food and sugar from the diet as much as possible. Sleep adequately. Now there's enough data to tell us that 7 to 8 hours of sleep for a young adult is very essential.
Yeah.
Because it eliminates all the toxic stuff that's going on. They've now discovered the glymphatic system, which allows you to do that. Exercise is key, right from a young age. You have to exercise right. And in my opinion, a great importance should be given to social interactions. A lot of people now are being glued to their devices, and that really takes a toll. And you can see it already, that it's taking a toll on teenagers being able to have a conversation.
Talk to us about that a little more, because bed rotting is real.
You can see, I mean, even in adults, we can't go to an unknown place without Google Maps now. In the olden days, we could do it. We can't calculate without a calculator.
Yeah.
We can't remember more than 4 or 5 telephone numbers.
Yeah.
So it is very, very evident in every single thing that we do. Our default response to get any answers to go to ChatGPT now.
Yeah.
We are not even attempting to think.
And how is that harming the brain?
Because it shuts down several functional circuits that you used to recruit to be able to get that answer.
Yeah.
You're not going to be able to write the way people wrote in
Now,
a century
holding
ago.
a pen, the other day
Yeah.
I wrote something and I'm like, wow, this feels new. Like
Exactly.
I always used to have a bump here
Yeah.
because of holding the
I
pen.
have
It's
it
gone now.
still.
And it just
Thanks.
felt like, real. It felt different. So it's blunting the brain.
It's
how
blunting,
I
it's
term
causing...
it.
it's causing some form of neuronal pruning, but in a bad way. It's pruning is a good thing when once you're an adolescent and whatever excess stuff is not required automatically gets pruned.
Yeah.
But when you are so dependent on your functioning to an external source and everything is available to you, like they say now, gone are the days where people used to spend time cooking a meal and actually relishing every single ingredient.
Yeah.
And because now you can get a meal in 2 minutes. So
At a
again,
click
that
of a
part of
button.
your brain gets switched off. Your purpose of direction, your creativity itself, in some sense, is because you are constantly being fed different ideas. So you're always trying to access a spot where you can get an idea to do your next venture.
Is there any positive that's coming out of this? Because if we are not using a certain center in the brain, obviously there's not going to be a vacuum there. Something else is going to take over. Or is it that our brain is shrinking and we are adapting to?
What's actually happening is they've done some morphometric analysis of the skull and they've found that the eye socket in teenagers is actually becoming slightly larger.
Oh.
Because of the sensory overload that's taking place. So in
But
some
that's
sense,
not a good thing.
It's not a good thing.
Yeah.
Soon, 100, 200 years later, we'll start looking like monkeys again.
Yeah.
So I don't think anything really good is going to come out of constantly. You'll get ideas, you'll be able to refurbish certain ideas. Technology helps you to do things much faster.
Yeah.
But again, it's blunting some of your skills that you had. Artists are going out of work because AI can now do everything.
Yes.
But where is the joy of that art?
Creativity.
Creating something with your own hands.
Yeah.
Thankfully, I don't think surgery, robotics aids in surgery to some extent, but it's more of a marketing gimmick than an actual aid. It does help definitely in very certain specific scenarios, but it's not like you can go check into a operation theater on your own. Someone will perform surgery and you'll check out on your own without human intervention. So
we will need neurosurgeons. We will need doctors.
You will need 100%.
Yeah.
At least for the next 100 years for sure. It's very difficult to really predict what's going to happen 100 years later. But the invention, see, you can't take away AI.
Yeah.
You can't reinvent it.
Yeah.
You can't undo it. It's here. You have to
it's
adapt.
Taking over. Like there is an app now where, it gives you everyday wardrobe. So it will select for you. I'm like, oh my
Easy
God,
for you.
are we going to depend on AI even to... But remember that, for me, the fear is that means my brain is not going to work.
Yeah.
So my constant fear is that how do I keep making my brain work so that it doesn't shrink? And I love the fact that some countries have banned social media. As much as I love social media, it has its place in our lives.
Yeah.
However, it's taking over, and that's not really a good thing for brain. Connecting it back to what our conversation was. So how do we keep it healthy? One is, of course, decrease...
The correct diet.
Yeah.
So food that's really good for the brain is all kinds of nuts, berries, eggs, fish, all your omega-3 fatty acids. Anything processed is bad for the brain. So eliminate everything processed. Sugar is the number one killer.
Why is that?
Because it causes a significant amount of chronic inflammation within the brain. Even though your brain requires glucose and glucose is the primary fuel, it doesn't require that much energy as much as we are providing it. And that excess glucose deposits along the arteries, along the blood vessels, and it causes a chronic state of inflammation. And these form plaques, and these eventually end up causing Alzheimer's and other neurodegenerative conditions of the brain. So
sugar is a no-no.
Completely.
Not needed. Sugar is not needed. We get glucose from the other food items that we eat.
My friends looking at this will wonder that I have such a sweet tooth and he is going out there and telling everybody not to eat. But exercise, some form of aerobic exercise and a great amount of strength training especially after a certain age, after the age of 35, 40, you have to do strength training because strength training itself has a direct impact on cognitive performance. And you have to be able to sleep correct and eliminate cigarette smoking completely, alcohol as much as possible, and all kinds of recreational drug use is completely harmful to the brain.
So you said that strength training or lifting weights is very, very crucial for brain health. Generally, the perception is that will improve our muscles. You look lean and toned, and your body will look great. How is it connected to the brain health?
It's connected to the brain health in terms of it gives the brain the exact amount of energy that it requires to perform its function through the day. There's a reason why you feel so rejuvenated after a workout, even though a workout is supposed to be exhausting and it tires you out. So there is a certain effect that pumping muscles have on the brain. They've studied over time that it actually physically enhances cognition, and even the type of exercises you do. If you focus on just heavy reps till fatigue is much better than doing multiple repetitions. Multiple repetitions are used for different kind of requirement of the body. But if you burn to fatigue, again, that provides a different spike in brain energy consumption, and that sparks of certain cognitive circuits which help you.
What are the things that one can do to keep the brain health going or keeping the brain healthy very easily, like, day-to-day activities?
Use your non-dominant hand for things that you've used your dominant hand for. For example, brushing your teeth. Do it with the left hand if you're a righty. Opening doorknobs. Do it with the opposite hand. Try and use your mouse with the hand that you're not used to using it. Also, if you can learn a new skill, musical instrument, get a new language, new hobby, any of those things will...
So learning new things basically, and not only because the entire thing is do Sudoku and solve.
No, that's a very transient or temporary thing. See, that doesn't, it'll help in some channel or some corner of the brain. But you have to do stuff that involves a physical activity with a mentation in it. And that is the best exercise because the brain understands symmetry, the brain understands movement, and then it syncs movement with memory and it locks a circuit. And that's the way to do it.
So what I do is I stand on one foot. I take turns when I brush my teeth. So it also helps me balance because yoga is not possible every day. And again, one of the things that one loses as we age is your sense of balance.
Yeah.
So to keep that, I keep that going. So hopefully some synapses are getting
of course.
connected.
There are 100 billion neurons in the brain forming close to 300 trillion synapses. Don't ask me who counted them.
I was just wondering.
But you have to keep constantly making sure that they're connected, and those are the things that you can do. There must be hundreds and thousands of little things that you can do on a daily basis. But the problem is that we are so used to doing things a certain way that you'll brush for 2 days with your left hand, but then automatically you'll switch to your, because it's a little inconvenient.
Yes. Now, there is also this understanding, I don't know whether it's myth or not. However, COVID has caused a lot of brain fog and loss of memory in people. One doesn't know whether it's the
vaccine or the...
Yeah. So,
you'll never know.
We won't know.
You'll never know. You'll never know. We know that COVID was in some sense a disorder that caused some form of a coagulopathy in the sense that it caused the blood to become thicker. It caused a sludging of blood within the blood vessels, and that certainly caused a significant degree of strokes in patients. So the blood supply that normally would go to a brain has been hampered either by the disease itself or probably the side effects of the vaccine. You'll never really know because the vaccine involves administering the bacteria.
The bacteria itself, the dead bacteria,
So you'll never know. People keep saying that there's an increase in the number of heart attacks because of the vaccine, but it'll always be speculation.
Right.
So same thing, anything that affects the blood vessels. So just like it's affecting the heart, it's also affecting the brain. And if you're not able to supply the amount of blood that your brain needs. And that's why the importance of exercise, that you're able to at least pump up the heart rate to a certain degree that allows you to get that blood going through the brain. And that is why a sedentary lifestyle is universally harmful.
I'm circling back to exercise or workout. What do you think of yoga? Because why I'm asking you this is because I love all these topics, right? So I do a lot of research into what form of exercise, what workout, etc., etc., and how to balance it out. Because if I'm working out thrice a week, I'm going to the gym and doing weight training, I become stiff. So to keep the flexibility going, and the reason why I'm asking you is because you are a neurosurgeon who operates on brain and spine. Spinal health is something that not too many people are aware of, don't know much about. And what I feel is one of the main things of aging is your deterioration of your spinal cord as well as your vertebrae. And to keep that healthy, yoga plays a very big role. Does yoga also impact the brain? What are your thoughts on this?
Of course. I mean, yoga in some sense means the union of the body and the mind.
Yes.
When you hold a certain pose in a certain fashion for a certain period of time, it does trigger something within the brain at a microcellular level. It changes a little something within the brain. And that's why the mind-body connection is so important. And if you can mix your workout by exercising a couple of days a week with weight training and then stretching, yoga itself, if you use your body weight to do certain positions and postures, also requires a great deal of strength. So the combination works beautifully, and you must recommend it to everybody that you meet, because eventually you have to be flexible. The spine loves mobility.
Yeah.
The spine loves movement. The body, in fact, loves movement.
So that's what they're saying, right? Sitting is the new smoking.
It's horrible. Sitting. So that's why I recommend
long.
everybody to stand up every 20 to 30 minutes because it causes a significant degeneration in the spine. And most people who come to me are people who have desk jobs.
Yeah.
They're sitting for 8-10 hours continuously. They just get up for a little bit of a coffee break in between.
Yeah.
Or they get up to smoke, which is even worse. So whatever job, there's no job in the world where you can't get up every 20 to 30 minutes.
Yeah.
So you just do that amount, some basic amount of movement. And now again, there's enough data to tell us that instead of just exercising for 1 hour through the day, you try and scatter your exercise through the day. Instead of doing it one time during the day and then just sit for 10 hours. That's actually more harmful than, let's say, doing 10 squats every hour.
Yeah.
Or maybe do 10 push-ups thrice a day or 4 times a day. Those are the things that research is showing us is more beneficial than spending an hour in the gym and then rest of the day sitting in front of a computer doing your day job.
No, also NEAT. NEAT. It is great because that also burns calories, right? I mean, throughout the day, because weight gain or weight loss is a big topic. Whenever you go to a party, the first thing you will always hear people saying that, oh, you've lost so much weight. And I'm like, I'm the same from last time. And
it's a conversation starter.
Yeah, exactly. But when I speak to my clients or my friends, I always say that throughout the day, just be active. Even if it means you're fidgeting, it's okay. But that will keep your brain active, it will keep your body active, and there will be weight loss.
Yeah.
So that's a good thing. Now, let's talk about brain health and sleep.
So sleep is one of the most fundamental requirements of the human body. It's not to be considered as a state of rest, but a state of maintenance, I think. Sleep allows you to regulate and rewire and do all of those things that you've been through during the day, eliminate all kinds of waste, eliminate all kinds of toxin. There's a reason why there's this old saying that there's nothing a good night's sleep can't solve.
Yeah.
Right?
Yeah.
Even if you get into an argument with somebody, say just sleep over it tomorrow morning, you'll be better off.
Yeah.
So it's no rocket science. And it's been followed for millennia.
Yeah.
Now, just because everybody emphasizes so much on productivity, people are talking about, oh, can we go about our day with 4 hours of sleep? And some people say, I require just 5 hours of sleep to function. But what it does is that the lack of sleep impairs your perception of impairment itself. So the thing that is telling you that you're not okay itself is not okay. See, the brain does not revolt immediately. It is quite resilient when you're giving it small hits, but at some point it'll give way.
So what does sleep exactly do to the brain? And explain glymphatic system.
So the glymphatic system was a system that I think they discovered somewhere around 2012, where it's different from the lymphatic system. The brain doesn't have a lymphatic system. A lymphatic system is in rest of the body that eliminates toxins from the various processes that the body goes through and then eliminates it through blood, bottom line. And now the brain has been identified with such a system that allows us to eliminate all the waste products, all the toxins that we've accrued through the course of the day. And it requires the brain to be in a certain resting state for this process to take place. And now you'll be surprised that there are surgeons who are trying to do the same thing surgically to delay the onset of Alzheimer's by connecting the venous system to the glymphatic system by doing some form of an anastomosis. And they found in recent studies that patients who've had stage 4 to stage 6 of Alzheimer's have shown better cognition after this procedure. So what you've not been able to do by leading a healthy lifestyle, eventually you'll end up requiring a surgical procedure for. But I mean, if that also shows promise in a randomized control trial, then who knows, we might be operating on patients for Alzheimer's at some time in our lives.
Well, let's hope so.
It's such a killer disease today that everybody's talking about it. I mean, people, when they say that I lost my dad to Alzheimer's, they don't actually lose them to Alzheimer's, but they're no longer the person they were before. And that's kind of, someone who's been really sprightly all their lives and someone who's been such a force, and suddenly you see them shrivel down to not remembering your name, not being able to recognize who you are.
Yeah. So in your work that you've been doing so far, what has been the most fascinating case that you've ever come across? Like, you've written a book. I mean, there are so many amazing stories, and I'm sure there is a whole load of stories that you have stored for maybe part 2, part 3, part 4. But there is always that one moment or one story or one patient which will always be there with you.
I mean, it's so difficult to really put a finger on, but more than, I think, the cases, I think it's the interaction with people that really changes the way you live your life. More than the surgical nuance or the surgical finesse of operating on patients, it's the stories they tell you, it's the decisions that they make for themselves. I had a couple who was dating for several years and they'd fixed a date for marriage. And just a couple of weeks after they had fixed a date, the guy got a seizure. And they did an MRI of the brain and they found stage 4 brain cancer.
Ouch.
And we know from data that most patients with stage 4 brain cancer live for about a year or 2. So it's this entire journey that you go through with a patient like this. First of all, would you marry someone who you know is going to die? Miracles and all do happen, but let's talk about common case scenarios. I mean, just what the wife or the so-called wife must be going through. Their thoughts, their feelings. They didn't cancel the date of the wedding.
Oh, wow. Okay. I'm getting goosebumps.
They went ahead
Wow.
with the surgery. They had a destination wedding with a small group of people, still remember. And then had radiation, had chemotherapy. 9 months later, he had a recurrence of the cancer, which we operated upon. and she was pregnant at the time.
Oh, wow. My God.
So knowing that first the decision of getting married, then the
Yeah.
second decision of having a baby.
Having a baby, yeah.
I mean, these are the things that
True
really
love.
stay with you
Yeah.
and really make you think and wonder. You can never put yourself. I always think, what would I ever get married if someone who I was going to marry was diagnosed with end-stage brain cancer?
Yeah.
I mean, if you sit
this is
in
very
the quiet
limited.
corners of your mind and ask these questions, you'll be surprised at the answers that everyone's supposed to do the right thing and be in love and do the things but would you actually do that? I had that guy lived for about 3.5 years after surgery, 2 surgeries, and then eventually passed away. But the wife is still in touch with me.
Oh, wow.
And
Hats
she's
off.
eternally grateful for having giving them that time together. And she's raising a child on her own.
Wow. Brave, very brave soul.
I had another lady who was about to get married. I don't know why suddenly marriage stories are popping up. But I mean, these are the most important decisions of your life.
Yeah.
You know, this is a girl who was coming back from a pre-wedding shoot.
I think that story I read.
The story is there.
Yes.
It's called Bridal Hiccups. And she just woke up one day and found that she couldn't move her legs at all. Zero. And then she couldn't get up to go to the washroom and lost function of bowel and bladder. The MRI showed a large hematoma, spontaneous blood clot compressing the spinal cord. And then we told the family that it has to be operated on now. But the question is that someone's getting married to somebody who probably may not have leg function, bowel bladder function. Would you be able to sustain that kind of life with a partner? I mean, love is good when everything works well, but when shit hits the roof, who is willing to really stand in your corner is what I have. And so we operated on her. Luckily, a couple of weeks later, she improved all her function back and she's happily ever after. She's absolutely fine right now. But I mean, what really intrigues me is the decisions that
the psychology behind the decisions.
And being a psychologist yourself, I think these are the things that really fascinate you, is how people take these decisions when it matters. How do you let someone who, let's say, has a massive hemorrhage in the brain, situations which you don't want to get into. There are certain things where you operate and they'll be absolutely all right, 100% guaranteed. But let's say deep-seated hemorrhages like hypertensive hemorrhages, which happen in the deep areas of the brain, where operating on it and relieving pressure can make you survive, but may not give you functionality. Some people will say, no, boss, I don't want someone like this to live with me. Or I don't want this for themselves. Whereas some people will say, I don't care if the fellow is vegetative also, I want them to be alive.
That's a tough call.
Nobody's right and nobody's wrong. It's a question of perspective.
And you have to go with the family's decision.
You have to go with the family. You can tell them based on your experience what you think would happen. The thing is that you have to take a decision in that half an hour.
Yeah.
And your emotions are so heightened at the time.
Yeah.
It's very difficult to let someone let go. But sometimes that might be the best thing for everybody. And sometimes you just want to hold on as hard as you can.
Yeah.
So these are the stories that really, stay with you. Rather than, there are stories of technical nuances where you've operated for 12, 18 hours at a stretch and you've had an excellent outcome. And there are stories where tumors bleed 2-3 liters of blood inside the brain when you're operating, and monitors are beeping and alarms are going off and the anesthetist is pumping blood and it's tension and it's, it's crazy. Your blood pressure is higher than the patient's blood pressure.
Yeah, I remember the statistics where they have monitored the neurosurgeons.
They've hooked on surgeons to monitors while performing certain operations, and it's astronomical that the kind of stress that the brain takes. And that's why probably we age much faster than other people. But those are things you remember for technicality, for nuance. But I think what really stays with you is some people, even long after they're gone, the lessons they teach you, the decisions that they've made for themselves in their lives.
Tell us something that you've gone or experienced.
We had a lady in whom we operated for a massive pituitary tumor. A pituitary tumor is the tumor that arises from the pituitary gland, but it was so big.
And pituitary gland is very
It's
small.
a pea-sized gland.
It's like a pea size, yeah.
But it had grown to about 7-8 centimeters. It was affecting her vision, and it had to be operated from the nose and from the head simultaneously. So it was a very challenging 7-8 hour operation. Went ahead and did it beautifully. We were able to remove the entire thing, separate it from all the blood vessels, relieve pressure from the optic nerve. And after surgery, her vision came back almost instantly. She was able to see very well and was ready for discharge when we noticed a little bit of CSF dripping from the nose, which is cerebrospinal fluid, which is probably coming from some defect in the skull that we had probably created. And then we treated her for that with another operation by re-repairing it. And then she was absolutely okay. She went home. 1 month later, she came back with high-grade fever. She developed meningitis, which is inflammation of the meninges.
The covering of the brain, yeah.
Covering of the brain. And then we had to give her antibiotics for 2 weeks. And then because of that, she developed hydrocephalus.
Oh my God.
So then we had to put in a tube to drain the excess fluid in the brain. And that hydrocephalus resulted in her from leaking again from the nose.
Oh my God.
So then we had to do another operation to fix that. And then she had certain pressure dynamics in the brain that kept fluctuating, and we were not able to fine tune the exact amount of pressure that required to be drained. And then she kept waxing and waning, kept getting better, kept getting worse. And one fine day, she stayed with us in hospital for 3 months. And everything was absolutely okay. We cut a birthday cake for her in the hospital, and she was ready to be discharged. And she had a seizure and died.
Oh my God. Just like that.
Just like that.
Oof. Wow. That must have been so tough.
So we toiled so relentlessly, and the family was so happy looking at, because we were agonizing. We had done everything right. We were agonizing, we were loathing, we were wondering what the hell is going on. Every time we had a complication, we stayed ahead of it and we were able to deal with it. And we finally thought that we had gone home scot-free. But sometimes nature has its ways, and how much ever you try, you can't defeat biology. You can't.
Yeah. You can only do that much.
You can't, yeah.
Oh, all right.
So these are the stories that somehow they just stay with you. And every time you're doing, for some strange reason, a similar case of that nature, you have flashbacks of a patient who didn't do well. Even though that's just 0.1% of the spectrum, right? 99% of people walk out happy. They're so grateful that they had the operation. And that's what keeps you really grounded.
Yeah, but you have so many miracle stories as well, right? For again, one of the stories that you've narrated is where you had predicted. I mean, I know that it is not 100% ever, because you can't, that the patient will not walk but came walking.
Yeah.
So tell us a little more of these miracle stories.
So
a few more.
So this is a guy who had a spinal cord injury. He fell off a horse and while he was vacationing somewhere, was airlifted and got to us and had a almost complete transaction of his spinal cord. So if bones are stacked up on top of one another and the spinal cord goes through it, these bones had moved.
Yeah.
So the spinal cord is lacerated.
Yeah.
And he was grade 0 power below his legs, no bowel and bladder function. And we told him that, listen, we are going to fix this so that you're able to do physiotherapy, you're able to do rehabilitation, but it's almost uncertain that you're going to be able to walk again.
Yeah.
You never take away hope completely from a patient. Even though you think in some recess of your brain that he's never going to walk again. You never give any patient a timeline that even if they have an end-stage cancer that, oh, you're going to live for 3 years.
Yeah.
I never say that because I've been wronged.
But that happens in films. Now, 6 mahina hai sirf aapke paas.
Yeah.
And I keep telling my producer and director friends that please don't create this because this doesn't happen in reality. No doctor will say that, that finite time you have 1 year to live or you have 6. That's just wrong.
Yeah. Because there are outliers.
Yeah.
And outliers teach us several things that the regular population will not teach you. And it gives you an understanding of disease that you otherwise wouldn't have. And explains to you processes that are beyond your comprehension. So coming back to that guy, when he got discharged, I told him it's unlikely that he'll walk. I told the mother. And the mother very, very sternly told me, आपने आपका काम किया, अभी हमको हमारा काम करने दो. So, with a certain degree of belief and fortitude, and I kept in touch with him for a while. They came for a follow-up at 3 months, 6 months, almost no function back in the legs, but kept exercising, kept doing everything that required to be done. And then 3 years came into my office walking. I didn't recognize him. He says, you won't recognize me because you told me that it's unlikely that I'll walk, but here I am. And the mom said that besides doing everything I had to do, we recited the Hanuman Chalisa every single day for the last 3 years. And we have to accept that there is the power of faith, the power of conviction.
Yeah.
There are some things that science will not be able to explain. And we have certain miracles like this on a daily basis that people will completely come and bewilder you so that you almost feel small thinking that, oh, you were this guy who passed a certain decree saying that this is what will happen, but nature had other plans. So you have to be, I think you have to, as a surgeon, be audaciously optimistic. So don't deal with any diagnosis with a certain degree of finality because you never know what the outcome is.
So now when I had said earlier on that we all take our health and our brain for granted, what are those signs that one should not neglect? Like if this is wrong with you, rush to the hospital.
I would say even small, ordinary, dull aching headaches. If you have a simple, ordinary headache that's not going away in a couple of weeks, you've taken some medication, you've taken everything to check it out. You've checked your eyes. Common cause of headaches is a refractory error. Sometimes you can have a sinus problem that can cause headache. Obstructive sleep apnea can cause headache.
Yeah.
All of those things, if you've checked,
ruled out.
Sinus problems, temporomandibular joint problems, a ear infection can give you a headache. I would say I recommend everybody to do an MRI because I see at least 10 to 15 patients a year who are young adults, our age, if we can call ourselves young,
yeah.
who all they have is a dull aching headache and they end up having a brain tumor. It might be benign, it might be malignant, it might be something that you might even not operate on. But at least you're able to diagnose something. And in many cases, you're able to operate on it and give them a completely new lease of life. So a dull aching headache that doesn't go away in a couple of weeks, even though it's not interfering with your day-to-day function. You're able to go to office, but something's irritating you. You don't have any dysfunction in your hand and legs. You don't have any tingling, numbness, any double vision, any visual problems. Still, I would suggest get an MRI done. That's one symptom. Obviously, if you have a sudden onset severe headache, that's the worst headache of your life. You go and see a doctor. So even something as back pain. 99% of back pain is muscular. And it will get better with physiotherapy, with exercises, with correcting your posture, with some lifestyle changes. But if you are that 1 to 2% that has a spinal tumor, you can just have simple back pain that's not going away.
Correct.
If you have a spinal infection, TB of the spine can just present with back pain. Nothing else. Especially in young children, if you see children complaining of back pain. Children normally never complain
They
of
don't
pain.
have, yeah.
So it should be a red flag. Parents just, I've had so many people just tell children that he doesn't want to study, that's why he's making excuses.
Yeah.
But they have a
They have
structural
an actual
pathology that's causing these symptoms. So, and another thing is memory problems in the elderly. If you have memory dysfunction that's affecting your day-to-day functioning, let's say, names, places, keys, everybody forgets.
Yeah.
You forget where you've kept your keys. But if you forget, let's say, what keys are used for. If you've gone out somewhere and you forget your way back to your home. If you are confusing the names of your children. If you are having a memory disturbance that is affecting your day-to-day functioning, I would say scan it. Because a lot of the times frontal lobe tumors, they present with all sorts of vague symptoms. I've had a patient with a frontal lobe tumor who said that I don't like the taste of my wife's food anymore. And his wife thought that he's just being difficult. But it was a frontal lobe tumor affecting the olfactory nerves.
So the taste,
the taste gets affected. Personality changes, especially elderly people when they start behaving slightly differently. Children think that mom's just lost it, or she's gone cuckoo, or
old age.
Old age. Everything's attributed to old age. I would say that scan somebody. See, my basic funda is very simple. You rule out something structural. You rule out something, and an MRI today is available at every nook and corner of the city. You rule out something structural. If you've ruled out something structural, then you do whatever you want. Then at least you're not risking something that's potentially reversible. Similarly in the spine. If it's not getting better with conventional treatment in a couple of weeks, then scan it. Because you never know. Diseases don't read textbooks. Even though
that's true. That's a good line.
80% of the time, based on what patients present, textbooks are written about. But you will continue to find, as you see more and more people with the same pathology, you'll find varying symptomology of the same problem. Something as simple as menopause or perimenopause. A lot of the times you have symptoms that overlap. Brain fog, forgetfulness, loss of concentration, inability to sleep. All those symptoms can overlap, but you need a thorough clinical examination. You need to ask certain pertinent questions. All I'm saying is don't attribute it to old age, or don't attribute it to menopause, or don't attribute it to stress. Get it investigated. Once you've got it investigated, then you go down your path as to whatever works.
Now that you mentioned menopause, I'm going to take that up as the next topic because that's something that I have been working on very closely. Let's talk about menopause and brain. What is the connection between perimenopause, menopause, postmenopause, and brain? So,
I think it's a very important question because everybody needs to discuss it. A lot of the times I have a lot of friends who are perimenopausal and we keep making fun of them. But it's a neuroendocrine event.
Yes.
It's not only an reproductive system event. Estrogen, a lot of people forget, is very important for a lot of brain function. So estrogen receptors are very strongly present in the medial temporal lobe, which is the amygdala, the hippocampus, which is responsible for memory restoration, forming new memories, in the prefrontal cortex, which is responsible for, like we mentioned, insight, judgment, decision making. And when estrogen depletes, it's also responsible for the synaptic connections between the brain. So those get affected. So when they get affected, your mood gets affected. You start having lapses in memory, concentration. There's a certain degree of mental fatigue, certain degree of physical fatigue, decision making. That's why it's called brain fog, right? Everything becomes a little cloudy. To be able to identify it, first of all, and acknowledge it is the first step. And then in consultation with either an endocrinologist or a gynecologist, you may require to supplement it with medication. A lot of the times, just simple things like sleeping properly. The problem is that estrogen depletion causes hot flashes which happen at night.
Correct.
In a lot of women. And that itself depletes sleep, and primarily the REM part of sleep, which is responsible for restoring function. So when that starts getting affected, it's like going 2 weeks with 4 hours of sleep, you'll automatically become a zombie, right?
Yeah.
And that's why sleep is so important. And that's why exercising is so important. Again, if you're able to resistance train and do some form of aerobic exercises, it increases production of estrogen within the body. So, or you supplement it medically based on the recommendation of your doctor. So it has a definite, like all these changes that happen in women, puberty, pregnancy, and perimenopause, the 3 Ps, as we call them.
Yeah.
They are all neuroendocrine events.
Yeah.
So you can't isolate it. And it's important, I think, that gynecologists should speak with neurologists, should speak with psychologists.
Yeah.
And that is why now you have all these menopause clinics that have a combination, that have a holistic approach to be able to treating these conditions. And I think a lot of women have greatly benefited from that.
Yeah. Yeah. No, this chalta hai, hota hai, humko bhi hua tha. Now, what are you making a big fuss about?
Yeah.
This whole generational debate that is going on, a fight that is going on, I think just because there was suffering, it doesn't mean it needs
that
to
it has
continue.
To. You have to break that pattern.
We have
you have the tools to
you have
the tools to deal with
so
it.
Why
you have the tools to identify it, first of all.
Yeah.
Initially, it was not even spoken about.
Yeah.
It's like any form of, even our awareness of mental health has increased to such a great extent. So all of those things, if we have that awareness, we are able to deal with it much better.
Yeah, true. Yeah, so we were talking about the perimenopause and menopause. What about the menopause brain? Once the event is over, estrogen is over, progesterone, and so suppose a woman does not take HRT, what happens to the brain in that stage?
I think at some point after the whole cycle is over, it resets. And that's the best part about it. You don't really see symptoms of it lasting. So after the age of 55, if you keep telling your husband that you're having brain fog, he's not going to accept it.
I shouldn't, because it's then an excuse.
Then it's an excuse. So 45 to 55, maybe a couple of years above and below also. But then what happens is that the brain has a reset button. And somehow it finds its way back to what is called as homeostasis or a balance.
Okay, now coming to you as a human being, Dr. Mazda, as a human being, from the book, what I gathered is that you have, of course, great sense of humor, that's a given, but there is a very poetic side to you. Were you always inclined towards that part, or did you Just the fact that the way you described the brain when you saw it for the first time, pulsating.
But the brain itself is so beautiful.
It allows your brain?
Everyone's brain. It looks the same. If I open your head tomorrow.
Yeah, of course. No, because we are talking about you as a human
being.
Yeah,
so I mean, literature is such a beautiful way to express your thoughts and your feelings.
Yeah.
And if you're able to, I'm sure most doctors who operate feel a certain awe whenever they're operating on the organ that they're operating on, except urologists, I guess. But they
you never know.
they feel a certain mesmerization. At least I, every time open the brain or the spinal cord, I'm constantly just telling my assistant, this looks so beautiful. Yeah, this looks, you can sit and watch it all day long. So then it lends itself to a certain degree of a poetic charm that you're able to bring in and express. So a lot of doctors who've read the book or the stories that I write, they tell me that we feel the exact same thing, but somehow we are not able to put it down on paper. But it's all...
But that is what it is, right? It's about expressing that side of you.
Yeah.
And if it is there, it's there. Like, I'm terrible writing essays. I will write everything in point form. I am not an expressive person on paper. It now doesn't bother me because I use ChatGPT anyway. But... so I know that I appreciate art and I appreciate the beautiful writings of different authors, but it's not there in me. Yeah, but it is there in you.
I mean, everybody can't be good at everything, right?
Yeah. But there is this poetic side. So what I'm trying to say is, did you know about it, or was it a discovery that happened after or when
I
you started
think
writing?
it is a discovery that happened after I mean, I used to write a little bit, but it was not medicine. It used to be about my travels. It used to be about family. It used to be my daughters gave me a lot of material to write about. So that was, but the looking at anatomy and then being able to describe it.
Yeah.
Once I started doing it, I started doing more of it, and I started finding different ways to be able to write about the same thing without it being monotonous. At least that's what I think. And I think the more you do something, the more you tend to get better at it, and you're able to diversify in what you're doing.
How do you take care of your brain health? Because given the fact that you deal with a delicate organ, a delicate balance where health, personality, memory, plus the family is concerned, because it is life altering. It can literally, not only for the patient, but for the family, change their lives. That is a lot of pressure on you. That is a lot of responsibility on you when you operate or when you consult a patient. How do you deal with stress?
So I think I'm a pretty chilled out guy. So I don't, but the downside of it is I'm very emotional as well. So any kind of patient complication or patient distress, I take very personally.
Empath.
Which I don't think, I'm trying to develop a little bit of a thicker outer coat, but it's still very difficult for me to, I obsess over my patients. I agonize over them. I'm constantly wondering whether we are doing the right thing. Every time I walk into an operation theatre, the first statement I ask my colleagues and assistants, does this patient really need surgery? And they tell me now it's too late to ask that question because the patients. So I'm always constantly doubting myself, not in a underconfident way, whether I'm capable of doing something, but whether the decisions we are making for patients' lives, are they the best thing for them? And is this, or is there something better that we could offer them? So that kind of stress is what I take. But I have an extremely good social circle. I have great friends, family. All of those serve as perfect stress busters, but they also sometimes bear the brunt of what you go through at work. And it could also take a toll on relationships, on the people you're like. Even when I'm on a holiday, I'm constantly on my phone checking what's happening. Is this patient okay? Is that patient okay? So sometimes they ask me, you're not totally present, but I'm absolutely present. But a small section of my brain is in the hospital, constantly is worrying about the patient that I've operated on. Are they okay? And I don't have, when patients call me at odd hours, it doesn't really bother me. I'm happy to respond to them. So I'm like part of their healing journey. And when they don't need you anymore, they'll automatically go away.
Disappear,
so my daughters tell me that we don't want to become doctors because you get too many phone calls. So if you really like what you're doing and you have a way to enjoy it, and at the same time you have certain extracurricular hobbies, like I trek a little bit. I'm an outdoor person. I don't like staying at home. I have a great social network. So all of those things really taking care of your brain. I used to not sleep as much. I used to function with about 5 hours of sleep, and now after all this data that I've read, I try and at least sleep for 6-7 hours a day. So I think that's how I don't barely drink, don't smoke, exercise a little. So I'm pretty sorted.
When is the next book coming?
If this book gets a little bit of love, we have enough stories for another book for sure.
I'm sure.
And they're such beautiful stories of love and loss, of grace and grit, of resilience. There's so much actually that other patients can take from these stories. It gives
it's
a lot
motivational.
It gives them a lot of strength. It gives them, a lot of the times people ask when they are confronted with a serious illness, why me? It's the commonest question, right? I've not done anything wrong in my life. I like to tell them that our graces don't stand to reason as much as our sins do.
Mm-hmm.
So we just have to help people walk each other home, I guess.
Yeah.
And that's why these stories, they're less about anatomy, they're less about
Yes.
surgery, though they give you a little insight into the functioning of the brain. They're more about the human connection,
the human side.
They're more about what we feel as individuals on a daily basis, how we deal with hope, how we deal with loss, what does losing someone you've loved so dearly mean, what happens when...
And you can lose them not necessarily to death, right?
Yeah.
I mean, the
You can
person
lose
might
them.
be alive and well and functioning, but
Yeah.
it's not the same person.
Correct.
How do you deal with that?
There's a chapter on this in the book on caregivers, and which nobody really talks about. There's a great burden on
of caregivers.
absolutely functional people who are caring for people with certain illnesses and diseases in every corner of the world today.
Yeah. So, in fact, for my Harvard capstone, we had to give 2 ideas to our professor, and then they would approve one. So, my second idea, it was at par at that time, was caregiver's burden.
Yeah.
Because nobody appreciates, understands, and it's just taken for granted that it is your duty.
Yes.
It is your responsibility at the cost of their mental and physical well-being.
Absolutely.
And I'm so glad that you're touching upon that, because especially where brain and the illnesses of brain are concerned, the person who's a caregiver, they have a lot.
And luckily, we
handle.
now have more and more people who are helping patients with end-stage problems or diseases or illnesses, and they're forming support groups, and there are NGOs who are doing all of this work. And it's a very, very important thing to look after people who are looking after people.
Because there has to be a respite.
Similarly, for doctors, in the West at least, they have counseling for doctors. They have certain support groups for doctors. When a doctor loses a patient, what they go through, people think that they're not bothered by loss.
A lot of people ask me, doctors don't feel any emotions, right? They see misery and disease and illness and death day in and day out, so they just stop feeling. And I'm like, no, it doesn't work like that. They're still human beings. And they have to assess, analyze, and get over it and be the doctor that the next patient wants them to be.
Yeah. Recently, I was at a funeral, and a friend of mine told me, you must be so used to seeing dead bodies. So I told him, I'm not that bad at what I do. So there's, again, the book actually busts a lot of preconceived notions that we have about the world of medicine. And about illnesses in general, and how people look at illness.
So, Dr. Mazda, thank you so much for coming on the Dr. Aditi Govitrikar Show. Just a small tidbit is that I was in Bheja Fry 2. I acted in that film. So I'm hoping that Bheja Fry 2 also releases soon.
I love that.
Looking forward to it.
It's going to be called Bheja Deep Fried.
Thank you so much.
Thank you. Pleasure is all mine.